So the fascia in your body is, I kind of thought of it as like a Spider-Man suit, that kind of just holds you on from the outside, but it actually goes everywhere. It penetrates all the way down into the cell, into the nucleus of the cell, and it's what holds everything together. It's kind of like the structural framework for the body. And fascia is very hydrated with structured water. It's a hydrophilic surface, and so water will structure itself on it. And they've actually shown this. Like, I forget the guy's name. He's French, but he has this video where he inserts a camera under live tissue, and he starts moving the tissue, and you can see the fascia like changing its connections to other fascia. It's like it's to me it's like the stairs in Harry Potter where they change like this, and it's like doing that with the fascia as the person's moving, but you can also see the wetness and the hydration of the fascia. So um so it's has the structured water on it, and we have the literature that shows that there's structured water, but when you have hydrated fascia and you move it, it creates this piezoelectric effect of tissue, which is also very well established in the literature that you can create this electrical current. I think that the fascia has to be well charged for that to happen. But when you move your body, you're basically you're freeing electrons from fascia and structured water to be pushed elsewhere. So you're basically able to use it. So if you charge up from the earth and you get sunlight and then you move, then you're moving those electrons to places they need to go, like into the cells where they can be used to make ATP and hydrate and things like that. So movement's a very big part of this. And then you get bound up fascia, you get scar tissue, which is very tightly packed fascia together. Structured water can't form on it because it's so tightly packed together. And so breaking up that scar tissue is very helpful, because if it's there, it interferes with this piezoelectric, ability to be sent from fascia somewhere else, or from somewhere to somewhere else.
Got it. So exercise itself isn't creating energy, but it's the fascia in our body that's almost like a storage of that energy through the structured water. When we move, we can release it and use it as needed.
Right. Yeah. So remember, like, laws of the universe say energy is not created or destroyed. So we can't create energy from movement, but we can, I say, mobilize energy as long as our body is charged enough. So we have to be in the right environments. And the more we move in the right environments, so I like to work out outside. People see me on Instagram, I'm using my bike in the sun. I'm trying to my Peloton or whatever. Um, Unfortunately, I can't lift weights in the sun. I have to go into a gym, but I'm only in there for like 20 minutes, and I can't justify buying my own weight set for 40 minutes a week because I only go twice a week. So, but anyways, yeah, you want to, as much as you can, move your body in that natural environment, because you're charging up, and then when the movement is just mobilizing energy, getting through that piezoelectric effect, moving it where it needs to go.
Okay, so when it comes to fascia, we've talked about active movement. What about passive? Things like foam rolling, massage, where some other inputs coming in, acting upon the fascia. Talk about that aspect.
Yeah, same effect as far as the piezoelectric effect, just more effective for breaking up the scar tissue. Gentle stretching, that's just like our movement, just like in yoga and things like that. That's going to have that piezoelectric energy. You're going to create that. When you mobilize it, it goes to cells and creates this anti-inflammatory effect. But when we're talking about breaking up fibrotic scar tissue and things like that, yes, foam rolling and that kind of stuff is it creates the piezoelectric effect, but it's more direct in breaking up. It's more of like therapeutic in that nature. But the thing that people miss from that is that's critical in a lot of places, especially if we have trigger points, bound up scar tissue, past traumas, injuries, things like that. It's important to get that tissue worked out, but then the hydration of it afterwards is also very important, because if you don't hydrate the scar tissue, those collagen fibrils, then they're just going to go right back to scar tissue, or they're more likely to go right back to scar tissue. So hydration means being hydrated enough, having enough water, but also infrared light, and grounding and things like that, things that increase the amount of structured water that can form on there. So I would say if you went and did some foam rolling or got a massage or whatever, it'd be really great to get sunlight after that, or at the very least do an infrared sauna or a red light panel, do something that can help hydrate the tissue afterwards.
When it comes to fascia, and we could use different words to reference adhesions, scar tissue, changes in the anatomy, how long can it take to work those out using these passive modalities?
Just depends on how deep they are, like and how big the scar tissue is, because it could be quite uncomfortable to try and like if it's a big nodule or whatever, it could be quite uncomfortable to try and get it all gone in one session. I've actually got some pretty gnarly cupping bruises on my back and my shoulder right now, just from breaking up scar tissue or getting that work done. Um, but it can also depend on how that trauma is stored, and how willing the body is to release it, because trauma can get stored in tissues, mainly from the fact that water can hold memory, and we're largely water. So yeah, how willing the person is to break that up. And so like you can get, when you get bound up scar tissue in places, it can create stagnant blood as well. Because when fascia is bound up, it can interfere with the blood flow, like not necessarily in arteries and stuff, but like in capillaries and in that interstitial fluid where the blood is, coming in and out, where there's kind of like this swamp. It can create this stagnant area. And so when you break that up, it kind of releases it and gets blood moving through there again. We get new blood in there. So it just depends on how deep it is. But I don't know. I don't do much soft tissue work in my clinic. So you probably ask someone who does soft tissue work more frequently, like how long does it take for the average person? Like how many sessions? Like what's it going to take? But yeah, sometimes it's more helpful to have someone else do it than you yourself, because in the process of trying to like foam roll or use a massage ball or something, you're like contracting muscles and getting to these weird positions trying to stabilize yourself, and you're just not as relaxed and not as willing to let go than when you're just laying there having someone else try and do it.
As a chiropractor, though, having your hands on people, can you actually feel sometimes when there is this bound up fascia? Or is it more theoretical and microscopic?
No, I can definitely feel like specifically in joint motion. If there's a lot of bound up scar tissue around a joint or in the tissue surrounding a joint, yes, that joint is not going to move like it's supposed to. And I can feel the difference. At first, I remember in school, like the teachers would tell me, you're supposed to feel this. And I'm like, what? I don't know what you feel. But now I feel, having felt so many spines and so many joints and how they move, it's easy. I can feel when a joint is knocked up and not moving like it's supposed to, compared to the joint below it or the joint above it or something like that. And so, you know, it may take a little work to do that, and it may take some work to get it to stay the way it's moving. If even I create motion in it as a chiropractor, or they do something that creates motion in it, it's going to take some training to get it to stay that way, and to retrain the tissue and hydrate the tissue after the breaking up of it has happened. So yeah, but all of that's is it's a process, just like anything else, just like changing your diet. Like it's going to take time, for you to do something that's sustainable and make it a habit.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
How much serotonin you make when you get UVA light in mid-morning is going to dictate how much melatonin you can make later when you block blue light after sunset. So the storage of serotonin, that's going to be converted to melatonin later. So I tell people